Barron Trump pretends to be a poor patient. What the hospital does next will outrage you. The waiting room at City General Hospital was cramped and buzzing with quiet chaos. Patients sat hunched in uncomfortable chairs, some clutching paperwork, others shifting uneasily as they waited for their names to be called. Barron Trump, dressed in a simple gray hoodie and worn jeans, sat quietly in the corner. He kept his head down, blending in with the crowd, just another face among many. It was exactly where he wanted to be. Barron's eyes scanned the room, taking in every detail. The chipped paint on the walls, the flickering overhead lights, the tired faces of overworked nurses rushing from one patient to the next. This hospital wasn't like the private facilities he was used to. This was a public hospital, one where patients with limited means came when they had nowhere else to go. He had come here with a purpose: to see what it was really like to be a patient with no connections, no special treatment, no name that carried weight. For this experience, he'd left behind everything that identified him as the son of a former president. No bodyguards, no private doctors. Just him, a fabricated story, and a mission to uncover the truth. The nurse at the front desk finally called his name. Brandon Smith? Barron stood and walked over, keeping his head low. The nurse gave him a cursory glance. "Fill out this form and sit back down. Someone will call you soon." "Thank you," Barron said, taking the clipboard. He returned to his seat and filled out the form, listing himself as unemployed and uninsured. Minutes ticked by. Then an hour. 2 hours. Other patients were called ahead of him, patients who had arrived after him but seemed to be receiving faster care. He noticed how some were greeted with polite smiles, while others, like himself, were barely acknowledged. Finally, his name was called again. A tall, stern-looking doctor with an impatient expression appeared at the doorway. His white coat bore the name Dr. James Halperin, and his voice carried a sharp edge. "Brandon? Follow me," he said curtly. Barron followed him down a narrow hallway, the walls lined with outdated medical posters. They entered a small examination room, where Dr. Halperin gestured for Barron to sit on the exam table. "All right, what's the problem?" the doctor asked, barely glancing at him as he flipped through the intake form. "I've been feeling really weak," Barron said, playing the part perfectly. "I get dizzy a lot, and my chest has been hurting." Dr. Halperin looked up, his eyes narrowing. "Do you have insurance?" "No," Barron replied. The doctor cut him off with a dismissive wave. "Of course you don't." Barron raised an eyebrow. "Excuse me? You wouldn't believe how many people come in here with vague complaints, thinking they'll get a free ride," the doctor said, his tone dripping with condescension. "Let me be clear, you're not getting anything more than the bare minimum without insurance." Barron felt a flash of anger but kept his cool. "I'm not asking for special treatment. I just want to make sure I'm okay." Dr. Halperin crossed his arms. "We'll run a few basic tests, but don't expect much. We have real emergencies to deal with." The doctor left the room without another word. Barron sat in stunned silence, his heart pounding. He had expected some level of dismissiveness, but the outright hostility caught him off guard. He thought about all the people who must experience this kind of treatment every day, people who didn't have the option to walk into a private clinic or call a personal physician. A nurse entered the room a few minutes later to draw his blood and run an EKG. She was kinder than the doctor but hurried, clearly stretched thin. "It might be a while before we get your results," she said, avoiding eye contact. "You can wait in the main room." "Thank you," Barron said, returning to the waiting area. His mind was racing. Hours passed. The waiting room emptied out, and Barron was still there. He watched as other patients, those with better insurance, were called back quickly, their cases seemingly prioritized. Meanwhile, the minutes dragged on for him, the hours bleeding into one another. Just as he was about to get up and ask for an update, Dr. Halperin returned, holding his chart with a smirk. "Your tests are fine," the doctor said, handing him the paper without much explanation. "Nothing life-threatening. Probably just anxiety or dehydration. Drink some water and rest." Barron stared at the paper. "That's it?" "That's it," the doctor said. "You can go now." Without another word, he turned and walked away. Barron felt a surge of frustration. The lack of care, the dismissive attitude, It was more than just bad service. It was a reflection of how broken the system was. He had come here to observe, but now it was personal. He knew it was time to reveal who he really was. Barron sat quietly in the waiting room for a few more minutes, gathering his thoughts. He knew the moment had come to reveal his true identity, but he wanted to make sure he did it in a way that exposed the deeper problem, one far bigger than just Dr. Halperin's rude behavior. This was about how countless people were treated every single day simply because they didn't have the right insurance or financial status. Taking a deep breath, Barron stood and walked toward the front desk. The nurse looked up, startled by his sudden approach. "Excuse me," Barron said, his voice calm but firm. "I need to speak with the hospital director." The nurse hesitated. "Do you have an appointment?" "No," Barron said, locking eyes with her. "But I assure you this is urgent. Please let them know it's Barron Trump requesting a meeting." The nurse's eyes widened in shock. "Barron Trump? You mean?" "Yes," Barron said, removing the hood from his sweatshirt. "That Barron Trump. And I think it's time we have a serious conversation about how patients are treated here." The next 15 minutes felt like a whirlwind. Hospital staff scrambled to arrange a meeting with the director. Whispers spread quickly through the hallways as word of Barron's identity reached every corner of the building. Nurses and doctors exchanged nervous glances, some clearly worried about what was coming next. Dr. Halperin, meanwhile, looked completely stunned when he saw Barron standing in the hallway with the hospital's senior administrators. His face went pale, and the smug confidence he had displayed earlier disappeared in an instant. "Mr. Trump," the hospital director said, extending a hand nervously. "I had no idea you were here today. If we had known..." Barron raised a hand, cutting him off politely. "That's exactly the point. You shouldn't have to know who someone is to treat them with respect. Every patient should receive the same level of care, whether they're a billionaire or someone without insurance." The hallway fell silent as Barron continued. "I came here undercover to see how patients without insurance are treated," Barron said, his voice steady and clear. "What I experienced today was unacceptable. I was dismissed, belittled, and made to feel like my health didn't matter simply because I didn't fit the rights profile. If that's how I was treated, I can only imagine how others are treated on a daily basis." The director shifted uncomfortably. "Mr. Trump, I assure you, we strive to provide the best care possible for all our patients." "I'm sure some of your staff do," Barron said, glancing at the nurse who had kindly taken his blood earlier. "But it's clear that others don't share that philosophy." His gaze fell on Dr. Halperin, who was standing nearby, trying to blend into the crowd. "Dr. Halperin," Barron said, addressing him directly. "Would you like to explain your behavior today?" The doctor cleared his throat, his eyes darting nervously. "But I didn't realize who you were. I apologize if I came across as harsh." Barron raised an eyebrow. "So, if I had been someone important, you would have treated me with respect?" Dr. Halperin opened his mouth to respond, but no words came out. "That's exactly the problem," Barron said, turning back to the hospital director. "Patients shouldn't have to be important to receive basic decency and care. Everyone deserves to be treated like a human being." The hospital staff looked on in silence, absorbing the weight of Barron's words. The director nodded slowly, his expression thoughtful. "You're right," he said. "We've failed in that regard, and for that, I sincerely apologize. We'll conduct a full review of our practices and make immediate changes to ensure that this never happens again." Barron crossed his arms. "Words are a good start, but actions matter more. I'll be following up to make sure those changes actually happen." "You have my word," the director said firmly. As the meeting broke up, Barron stayed behind to speak with some of the nurses and staff. Many of them were visibly relieved, thanking him for standing up for the patients who couldn't speak for themselves. "It's been hard for us," one nurse admitted quietly. "We've seen things like this happen before, but we didn't know how to change it." "Change starts with calling it out," Barron said. "And it's up to all of us to hold each other accountable." The story quickly made national headlines. News outlets ran articles with titles like "Barron Trump Goes Undercover," "Exposes Injustice in Healthcare System," and "Hospital Scrambles After Trump Reveals Poor Treatment of Uninsured Patients." The public response was overwhelming. People flooded social media with their own stories of being mistreated in the healthcare system, and a national conversation about healthcare equality began to take shape. Barron didn't shy away from the attention. He used it as a platform to advocate for change, meeting with policymakers, healthcare professionals, and patient advocacy groups. His message was clear: healthcare should be about healing, not about wealth or status. A few weeks later, Barron returned to City General for a follow-up visit, not as a patient, but as a guest of honor. The hospital had already begun implementing new policies: mandatory sensitivity training for all staff, a revamped patient feedback system, and an increased focus on providing equitable care for every patient. The director greeted him warmly at the entrance. "We owe you a great deal of thanks, Mr. Trump," he said. "You've helped us see where we needed to improve." Barron smiled. "I'm glad to see real progress. But remember, this is just the beginning. Change isn't a one-time event, it's an ongoing process." In the weeks that followed, Barron continued his advocacy work, sharing what he had learned from his undercover experience. He spoke at conferences, appeared on television interviews, and met with hospital administrators across the country. His message was simple but powerful: every life matters. Every patient deserves respect. And true change begins when we treat each other with dignity, no matter who we are or where we come from. One afternoon, Barron received a letter from a woman named Maria, who had seen his story on the news. She wrote about how she had been mistreated at a hospital years earlier and how his courage had inspired her to speak out. "Thank you for being a voice for people like me," she wrote. "Because of you, I feel seen for the first time in a long time." Barron folded the letter carefully and placed it on his desk. It was a reminder that his journey wasn't over, that there were still stories to tell, battles to fight, and voices to lift. And he was ready for all of it. Sometimes, change starts with a single act of courage. And sometimes, the most powerful revelations come when we dare to see the world through someone else's eyes. A week later, Barron found himself back at City General Hospital, but this time the atmosphere was entirely different. The once cold waiting room now buzzed with a new energy. Posters promoting patient advocacy and healthcare equality adorned the walls, and nurses greeted patients with warm smiles. The changes were subtle, but they were there, small steps toward building a better environment for everyone. Barron walked through the halls, greeted by staff and patients alike. Some whispered excitedly as they recognized him, while others approached to shake his hand. "Mr. Trump," a nurse said with a bright smile, "thank you for everything you've done. Things feel different here now. People are more aware of how they treat others." "I'm glad to hear that," Barron said. "But remember, this is just the beginning. Real change takes time." The nurse nodded, her eyes filled with gratitude. "We'll keep working on it." Barron continued down the hallway, lost in thought. He hadn't expected his undercover mission to spark such a movement. What had started as a simple idea had grown into something much bigger. The healthcare system had always been a point of debate, but now it felt personal. He had seen the cracks in the system up close, and he couldn't turn away from them. His thoughts were interrupted by a voice behind him. "Mr. Trump, wait." He turned to see Dr. Halperin approaching, his expression a mixture of nervousness and sincerity. "Do you have a moment?" the doctor asked. Barron crossed his arms. "Of course." Dr. Halperin took a deep breath, clearly gathering his thoughts. "First, I want to apologize again for how I treated you and for how I've treated others in the past. You were right to call me out. I've spent a lot of time reflecting on my behavior, and I realize now how wrong I was." Barron listened carefully, nodding but remaining silent. "I became a doctor to help people," Dr. Halperin continued, his voice quieter. "But somewhere along the way, I lost sight of that. The pressure, the endless stream of patients, the system itself, it all hardened me. But that's no excuse. You reminded me of what matters most, the people we serve." "I appreciate your honesty," Barron said after a moment. "It's not easy to admit when we've made mistakes. But what matters is how we move forward. Are you willing to be part of the change?" Dr. Halperin nodded without hesitation. "Absolutely. I've already volunteered for the new training program, and I'm working with the administration to improve patient care protocols. I want to do better." Barron extended his hand. Then let's make it happen together. They shook hands, a quiet understanding passing between them. Later that day, Barron visited the newly revamped Patient Feedback Center, where he was greeted by Maria, a young woman who had recently been hired to help manage the new initiative. "Mr. Trump," Maria said, her eyes lighting up. "I was hoping I'd get to meet you." Barron smiled. "It's nice to meet you too, Maria. How's everything going here?" "Honestly, it's been amazing," Maria said. "We've had so many patients come in to share their stories, both good and bad. It's been eye-opening for the staff, and it's helping us build stronger relationships with the community." "I'm proud of you," Barron said. "This is exactly what I hoped for when all of this started." "Well, you made it happen," Maria said. "Thank you for giving us a voice." As Barron left the hospital that afternoon, he felt a sense of deep fulfillment. The changes were real, and they were making a difference. But he knew there was still work to be done, not just here at City General, but in hospitals across the country. His experience had taught him a powerful lesson. Real change starts with listening, with seeing the world through someone else's eyes, and with refusing to accept the status quo. He couldn't stop now. In the weeks that followed, Barron launched a nationwide initiative called Patient First, focused on improving healthcare experiences for underserved communities. He partnered with hospitals, policymakers, and advocacy groups to create new standards for patient care. The initiative gained traction quickly. Town hall meetings were held in cities across the country, where patients shared their experiences and helped shape new policies. Barron attended many of these meetings, sitting quietly in the back and listening, always listening. One night, after a particularly emotional meeting in Detroit, a young girl named Sophie approached him. "Mr. Trump," she said shyly. Barron crouched down so he was at her level. "Hi, Sophie. What's on your mind?" "My mom says you helped fix the hospital," she said, clutching a small stuffed bear. "Thank you. When she got sick last year, no one listened to her. But now they do." Barron felt his chest tighten. "You're very welcome, Sophie. Your mom is lucky to have someone as brave as you by her side." Sophie grinned. "You're brave too." Later that night, Barron sat in his hotel room, reflecting on everything that had happened. The road ahead was long, but moments like the one with Sophie reminded him why he had started this journey. It wasn't about headlines or recognition. It was about people, real people, who needed someone to stand up for them. And he would keep standing for as long as it took. Several months later, Barron was invited to speak at a national healthcare summit. The room was filled with doctors, hospital administrators, and policymakers from around the country. As he stood at the podium, he thought back to that first day in the hospital. The waiting room, the rude doctor, the dismissive treatment. "It's easy to forget why we're here," Barron began, his voice steady. "But every patient who walks through your doors has a story. They're not just charts or numbers. They're people. And they deserve to be seen, heard, and treated with dignity." The room fell silent, his words resonating deeply. "The change we've started is only the beginning," he continued. "But together, we can build a system that works for everyone. A system where no one is invisible and everyone matters." The audience erupted into applause, many standing in admiration. As Barron stepped away from the podium, he felt a surge of determination. He knew this was his purpose: to listen, to learn, and to fight for those who couldn't fight for themselves. And no matter how long it took, he was ready. Because true change doesn't happen overnight. It happens when we refuse to give up. A month after the National Healthcare Summit, the momentum behind Barron's Patient First initiative was stronger than ever. Hospitals across the country had begun implementing new protocols, and patient advocacy groups were forming alliances to ensure lasting change. What had started as a personal mission had grown into a full-fledged movement, a beacon of hope for countless patients who had once felt forgotten. But Barron knew there were still challenges ahead. Changing individual hospital policies was a start, but there were systemic issues that required deeper reform. He had seen firsthand how bureaucracy slowed progress, how some administrators resisted change, and how doctors like Dr. Halperin were often overworked and burned out. Conditions that contributed to the very problems he was trying to solve. Determined to push further, Barron decided it was time to take his fight to the next level. He arranged a meeting with national policymakers in Washington, D.C., hoping to address healthcare reform on a broader scale. The meeting was held in a grand conference room at the Department of Health and Human Services. Barron sat at the head of a long table, surrounded by senators, healthcare experts, and representatives from patient advocacy groups. "Thank you all for being here today," Barron began, his tone measured but passionate. "What I'm about to share with you isn't just a story, it's a reality that millions of Americans face every day." He recounted his experience at City General Hospital, describing the dismissive treatment, the long waits, and the stark differences in care based on financial status. "This isn't an isolated incident," he said, glancing around the room. "It's a pattern, and it's happening in hospitals across the country." Several heads nodded in agreement. One senator leaned forward, his expression thoughtful. "Mr. Trump, what specific changes do you propose?" Barron smiled, grateful for the question. "We need a multi-pronged approach. First, we must invest in training programs that prioritize empathy and patient-centered care. Second, we need better support for healthcare workers, addressing burnout and staffing shortages to ensure quality care. And finally, we need to establish a system of accountability where patients have a voice and their concerns are taken seriously." A wave of murmurs swept through the room as the policymakers processed his suggestions. After the meeting, several senators approached Barron, expressing their support. They offered to sponsor legislation aimed at improving patient advocacy and increasing funding for public hospitals. For the first time, it felt like real, systemic change was within reach. But not everyone was on board. A high-ranking official pulled Barron aside. "You've made a lot of noise, Mr. Trump," the man said, his tone polite but cold. "Not all of us agree with your methods. Pushing too hard could disrupt the balance we've worked hard to maintain." Barron met his gaze without flinching. "If the balance you're talking about means that patients are treated like second-class citizens, then yes, I'll keep pushing. Healthcare shouldn't be about maintaining a status quo, it should be about saving lives and treating people with respect." The man said nothing, simply nodding before walking away. Barron left the meeting with mixed emotions. He was encouraged by the support he had received, but he knew there would be resistance. Change was never easy, especially when it threatened powerful interests. Later that evening, he sat in his hotel room, replaying the day's events in his mind. His phone buzzed on the nightstand. It was a message from Carl, the custodian at City General who had become one of his closest allies. "Saw you on the news. You're doing great work. Don't stop." Barron smiled and typed a quick response. "Thanks, Carl. I won't." Over the next few months, Barron's efforts continued to gain momentum. The patient-first movement spread to more cities, with hospitals adopting new standards for patient care. Advocacy groups worked tirelessly to hold institutions accountable, while patients shared their stories on social media, creating a groundswell of support. One afternoon, Barron received an invitation from City General Hospital to attend a special ceremony. They were dedicating a new wing of the hospital, and they wanted him to be part of the ribbon-cutting ceremony. The event was held on a sunny afternoon, with hundreds of people gathered in front of the newly built wing. The hospital director stood at the podium, addressing the crowd. "Today, we celebrate not just a new building, but a new chapter in our hospital's history," he said. "This wing is dedicated to patient advocacy and care, a direct result of the efforts led by Barron Trump." The crowd erupted into applause as Barron stepped forward. He stood at the podium, his heart full of emotion. "Thank you," he began, pausing to take in the faces before him. "This isn't about me. It's about every patient who's ever felt invisible, every worker who's ever been overlooked. This is their victory." He glanced at Carl, who stood near the front, smiling proudly. "This new wing represents hope," Barron continued. "A place where everyone, no matter their background or financial status, will be treated with the respect they deserve." The applause swelled again, louder and more heartfelt. After the ceremony, Barron mingled with the crowd, shaking hands and listening to stories from patients and staff. Maria found him near the entrance, her eyes bright with excitement. "We did it," she said, throwing her arms around him in a spontaneous hug. "This is just the beginning." "It is," Barron agreed, his voice filled with determination. And we're not stopping here. In the months that followed, Barron expanded the Patient First initiative internationally. Hospitals in Europe and Asia reached out, eager to adopt the same patient-centered care model. Barron traveled frequently, meeting with healthcare leaders around the world, sharing his experiences and learning from theirs. Each new step brought its own challenges, but Barron welcomed them. He had found his purpose, one that went beyond his name or his family legacy. This was about making the world a better place, one patient at a time. One evening, back in New York, Barron stood on the balcony of his apartment, looking out over the city lights. His phone buzzed again, this time, a text from Sophie's mother. Sophie wanted to say thank you again. She just finished her first day back at school and wanted you to know she's feeling stronger than ever. Barron's eyes misted as he read the message. Tell Sophie I'm proud of her, he typed back. And tell her to keep being brave. He slipped his phone into his pocket and took a deep breath. The fight for better healthcare was far from over, but Barron was ready. Because sometimes, true change takes time. And sometimes, it takes someone bold enough to believe that every life is worth fighting for.